Hi, I'm Dr. Andre Sasson of Lighthouse Weight Loss, and it is my pleasure to provide free education about GLPs. I want to share what I needed to learn before I started taking them. In this video, we'll talk about dosing semaglutide. I covered tirzepatide dosing in a separate video. Initial dosing. Semaglutide and tirzepatide are taken as once a week subcutaneous injections. If you are new to GLPs, I recommend that you start at the lowest dose, which for semaglutide is 0.25 milligrams. That's a quarter of a milligram. In a syringe, that is 10 units, just a teeny little bit of this tiny insulin syringe. We start at the lowest dose so we can see how well it controls your appetite, and so we can see how well you tolerate the side effects, usually nausea or constipation. If you get adequate appetite suppression from the tiny dose, great, you're lucky. Most patients are going to need a larger dose. The max dose is 2.4 milligrams, so there's a lot of room between a quarter of a milligram and 2.5 milligrams. In general, the more you take, the more your appetite is suppressed, and the faster you lose weight. My philosophy is that you should take the lowest dose possible that helps you hit your target, and once you get to your target weight loss, then you start cutting back and weaning and seeing if you can maintain the weight loss on a lower dose. I have a separate video about maintenance dosing. So, on semaglutide, you'll start at a quarter of a milligram, 0.25 milligrams. Then work your way up as needed. Keep in mind that the average weight loss on the maximum dose of semaglutide is 15% of total body weight. That's an average. There's a lot of variability person to person, but almost everybody gets great results. If you've been on GLPs before, we can consider starting you at a higher dose than the tiny dose, depending on how much you took previously and how you did with the side effects. How soon after you take a shot will you feel the appetite suppression? Well, about a half a day to a day. What about increasing your doses? How does that work? Let's talk about dose increases. If the dose you are taking is not strong enough for you, we can increase your dose at your next shot, so long as your side effects are tolerable. If you have trouble with side effects, I can help you manage them. Most patients have only mild side effects and they don't end up needing my help. But if you do need help with side effects or with dosing or with anything, consults are free. Initial and future consults are free because we want you to have great support to maximize your success. If you do book a follow-up telemedicine appointment with me and you want to talk about increasing your dose, I'll simply ask you, what dose are you on, how much weight have you lost, and how are your side effects? So long as the side effects are tolerable, we can bump it up. How much do we increase by? Semaglutide dosing is a little funny. You increase by either a quarter of a milligram or 0.7 milligram. Initially, you go up by 0.25. You go from 0.25 to 0.5, from a quarter milligram to a half milligram. The next dose is 1 milligram, so you go up by another half milligram. Then you go up 0.7 from 1 to 1.7, and then another 0.7 to 2.4. It's a little complicated, but we'll help you make your way up the table if you need to increase your dose. When can you increase your dose? Anytime. In fact, if you take the first dose, the initial baby dose, the 0.25 milligram dose, and in a day or two you feel it's not strong enough, you don't have to wait an entire week for the next dose. We can give you another dose 2 days later, because even if you take a quarter of a milligram one day and another quarter milligram 2 days later, you still only have half a milligram in you, and half a milligram is less. It's a fifth of the maximum dose, which is about 2.5 milligrams. So I think it's a reasonable strategy if you want to get going faster. What about dose timing? Does it matter what time of day you take it? Nope. Does it matter if you take it a day early or a day late? No. I mean, what matters is how much medication you have in you. Next up, tips for injecting the medication. I'm Dr. Sasson of Lighthouse Weight Loss, wishing you well on your weight loss and wellness journey. Thank you.